So hello, I am Julie Manis from BS Nursing 2A. Now I am going to present my case study, and my case study is all about anemia. First is the introduction. Introduction. Anemia is defined as a hemoglobin below 2 standard deviation of the mean for the age and the gender of the patient. Iron is an essential component of the hemoglobin molecule. That most common cause of anemia worldwide is iron deficiency, which result in microcytic and hypochromic red cells on the peripheral smear. Several causes of iron deficiency vary based on age, gender, and socioeconomic status. The patient often will have non-specific compliance such as fatigue and dyspnea on exertion. Treatment is reversal of underlying conditions such as well as iron supplementation. Iron supplementation is most often oral, but certain cases may require intravenous iron. Patients with iron deficiency anemia have been found to have a longer hospital stay along with a higher number of adverse events. The next is, what is anemia? Anemia is a condition in which you lack enough healthy red blood cells to carry adequate oxygen to your body tissues. Having anemia can make you feel tired and weak. There are many forms of anemia, each with its own causes. Anemia can be temporary or long-term, and it can be ranged from mild to severe. See your doctor if you suspected that you have anemia. It can be a warning sign of serious illness. Treatments for anemia range from taking supplements to undergoing medical procedure. You might be able to prevent some types of anemia by eating a healthy, varied diet. So, now is the symptoms of anemia. Anemia, signs and symptoms vary depending on the causes. If the anemia is caused by chronic disease, the disease can mask them so that the anemia might be detected by tests for another condition. Depending on the causes of your anemia, you might have no symptoms. Signs and symptoms, if they do occur, might including fatigue, weakness, pale or yellowish skin, irregular heartbeat, shortness of breath, dizziness or lightheadedness, chest pain, cold hands and feet, and headache. So next is risk factor of anemia. This factor places you at increased risk of anemia. A diet lacking in certain vitamins and minerals. A diet consistently low in iron, vitamin B12, and folate increases your risk of anemia. Next is intestinal disorder. Having an intestinal disorder that affects the absorption of nutrients in your small intestine, such as Crohn's disease and celiac disease, put you at a risk of anemia. Next is menstruation. In general, women who have not had menopause have a great risk of iron deficiency anemia. That do men and post-menopausal women, menstruation causes the loss of red blood cell. The next is pregnancy. If you are pregnant and not taking a multivitamin with folic acid and iron, you are at an increased risk of anemia. The next is the chronic condition. If you have cancer, kidney failure, diabetes, or any chronic condition, you could be at risk of anemia of a chronic disease. This condition can lead to a shortage of red blood cells. Slow, chronic blood loss from a ulcer or other source within your body can deplete your body's store of iron, leading to iron deficiency anemia. The next is the family history. If your family has a history of inherited anemia, such as sickle cell anemia, you also might be at increased risk of condition. Other factors, a history of certain infection, blood disease, and autoimmune disorder increase your risk of anemia. Alcoholism, exposure to toxic chemicals, and the use of some medication can affect the red blood cell production and lead to anemia. So the last risk factor of anemia is age. People over age 65 are in increased risk of anemia. So the next is a complication of anemia. Left untreated, anemia can cause many health problems such as severe fatigue. Severe anemia can make you so tired that you cannot complete everyday tasks. Pregnancy complication. Pregnant women with a folate deficiency anemia may be more likely to have a complication such as premature birth. Next is the heart problems. Anemia can lead to a rapid or irregular heartbeat. When you are anemic, your heart must pump more blood to make up for the lack of oxygen in the blood. This can lead to an enlarged heart or heart failure. Next is a death. Some inherited anemia such as sickle cell anemia can lead to life-threatening complications. Losing a lot of blood quickly results in acute severe anemia and can be fatal. So next is case description. A 10-year-old premature girl presented to the emergency department with an episode of syncope. She had been feeling progressively more tired for the last week, and her mother noticed that she was pale. And the girl had an intermittent headache, and they have a complainant of a palpitation, weight loss, and abdominal pain or rectal bleeding. Her diet consists of vegetable and meat. She is taking oral iron supplements because she presented with similar symptoms 4 months ago and was found to have a severe anemia. Hemoglobin of 4.9. The cause of the anemia that at that time was determined to be iron deficiency based on peripheral blood smear, iron study, and bone marrow examination. A stool-GCAC test was negative and hemoglobin electrophoresis yield normal result. After PAC red blood cell transfusion, she was started on ferrous sulfate supplement. Her anemia responded to iron supplements. Her hemoglobin 3 months later measured as 11 or 110. So the next is a general objective. The aim of this study is to help nursing students learn about a patient who has anemia. This will help you to understand what anemia is by providing you with accurate facts during the 3 phases of preoperative nursing: preoperative, intraoperative, and postoperative. The student knowledge and skill will be developed, assisting them in carrying out effective nursing intervention and management. So next is specific objectives. First is identify the etiology of iron deficiency anemia. Second is review the presentation of patient with iron deficiency anemia. Third is outline the treatment and management options available for iron deficiency anemia. Summarize the importance of improving care coordination among interpersonal team members to improve outcomes for patients affected by iron deficiency anemia. Second is a patient profile. Name is patient X, age is 10-year-old, birthday is May 18, 2011, and gender is female, address is General Trias, Cavite, nationality is Filipino, religion is Roman Catholic, civil status is single, and diagnosis is severe anemia. Next is a patient history. Patient health history. She had been feeling progressively more tired for the last week, and her mother noticed that she was pale. The girl had an intermittent headaches, and they have complaints of palpitation, weight loss, abdominal pain, or rectal bleeding. History of the patient illness. She is taking oral iron supplement because she has presented with similar symptoms 4 months ago and was found to have a severe anemia. So the personal and social history of lifestyle is patient X. She is the only child and a simple schoolgirl who have a dream to become a doctor someday. So, third is review of the system. So, in general, patient seems weight loss, skin, patient is slightly pale, negative for any lesion or wounds, head, round, face is symmetrical, has a sprinkling of prickles across cheek and nose, no lesion, swelling and scars noted. Eyes are black, symmetrical, non-protracting, and both are active. Patient has bags under her eyes. Ears, negative for any discharge, lesion and swelling. Hearing is intact with a good acuity. Nose, located in midline of face and no lesion, swelling or bleeding present. Both nostril patent. Throat, no lesion and swelling presented, no palpable mass or lumps noted. So the next is neck, straight and symmetrical, no visible mass or lumps, no lesion and swelling present. So the next is the breast, no lesion and swelling present, normal. So normal po ang skin po is pale, and head, eyes, ears, nose, and throat is normal, and neck and breast is also normal. So next is respiratory. Lungs are clear to osculate bilaterally. No shortness of breathing or cough. So it is normal. Cardiovascular. BP is 100/70. No chest pain. Hematologic level is 4.9. Gastrointestinal. With abdominal pain or rectal bleeding, normal bowel sound, non-tender and no guarding peritoneal sign. Urinary genital. No pain upon urination, no other urinary and genital problems noted. Neurologic, frequent headaches. Peripheral vascular. There is no swelling presented in the patient. Ankles and feet, no cyanosis. So, it is normal. Musculoskeletal, lower and upper extremity within normal limits. Here is a physical examination. Conscious and coherent. Vital sign upon admission. Blood pressure is 100/70. Pulse rate is 84. Respiratory rate is 20. Temperature is 37.2 degrees. SpO2 is equal to 100%. Weight is 63 or 28.6 kg. Paleness of skin, active for paleness of skin, pain, and rectal bleeding. So 5 is anatomy and physiology. So this is the picture of my anatomy and physiology. Blood is constantly circulating fluid providing the body with nutrition, oxygen, and waste removal. Blood is mostly liquid with numerous cells and proteins suspended in it, making blood thicker than pure water. The average person has about 5 liters, more than a gallon of blood. Blood vessel wall is the wall that forms the tubular channel of blood flow. The walls of arteries and veins consist of 3 layers: tunica intima, tunica media, and a tunica externa. The most inner layer is tunica intima, consists of a surface layer of endothelium with a basement membrane. In the case of arteries, there is no internal elastic membrane around it. The tunica media is composed of smooth muscle and connective tissue. In the case of arteries, there is an internal elastic membrane around it. The tunica externa is the connective tissue forming the outermost layer. The walls of capillaries consist of a single layer, an endothelial cell, and a basement membrane. Blood vessels are the channel of a conduit through with blood in a distributed to body tissues. The vessel make up 2 closed system of tube that begins at the end of heart. One system, the pulmonary vessel, transports blood from the right ventricles to the lungs and back to the left atrium. So next is white blood cell, are also called leukocytes. They protect you against illness and disease. Think of white blood cells as your immunity cell. In a sense, they are always at war. They flow through your bloodstream to fight viruses, bacteria, and the other foreign invaders that is threatened your health. The next is red blood cell. Deliver oxygen from the lungs to the rest of the body and carry waste product to be released by the lungs or the kidneys. Red blood cell contain a hemoglobin, which is the protein that is bind and release oxygen. So platelets are colorless blood cells that help blood clot. Platelets stop bleeding by clumping and forming plugs in blood vessel injuries. So 6 is a laboratory and diagnosis. So the laboratory test results are hemoglobin is 4.9 or 49.0. Hematocrit is 9%. Mean corpuscular volume is 67.5. The white blood cell count is 4,200. Platelet count is 363 times 103. So 7 is pathophysiology. So again, this is the picture of my pathophysiology. Iron is essential to produce a hemoglobin. The depletion of iron store may result from blood loss, decreased intake, impaired absorption, or increased demand. Iron deficiency anemia could arise from acute gastrointestinal bleeding. Adult older than 50 years old of age with iron deficiency anemia and gastrointestinal bleeding need to be evaluated for malignancy. However, gastrointestinal diagnosis evaluation fails to establish a cause in a 1/3 of patients assessed. Iron deficiency will lead to microcytic hypochromic anemia on the peripheral blood smear. Because iron is the most common single nutrient deficiency, the American Academy of Pediatrics recommends supplementation. When to begin the supplementation and the needed dosage depend on the age and diet of the child. So 8 is a drug study. So name of drug and generic name is a ferrous fumarate. Brand name is Femiron. Mechanism of action provides elemental iron, an essential component in formation of hemoglobin. So indication, iron supplements, nutritional supplement, mineral. Preparation, dosage, and frequency. Iron deficiency, children is 100 mg per elementary iron daily in 3 divided doses. So contraindication, contraindicated in patient with primary hemochromatosis or hemosiderosis, hemolytic anemia, peptic ulcer disease, regional enteritis, or ulcerative colitis. So adverse reaction is nausea, pain, vomiting, constipation, diarrhea, black stool, and anorexia. So the nursing action and consideration, check for constipation, record color and amount of stool, monitor hemoglobin level, hematocrit, and the reticulocyte count during the therapy. So alert, oral iron may turn stool black. Although this unabsorbed iron is harmless, it could be mass present for millennia. So the next drugs is, the name of drug, generic name is folic acid. The brand name is folate. Mechanism of action, increases red blood cell, white blood cell, and the platelet formation in megaloblastic anemias. Elevate the serum iron concentration, which then help to form a high or trough in the reticular endothelial cell for storage and eventual conversion to a usable form of iron. So the indication, folic acid is effective in the treatment of megaloblastic anemias due to a deficiency of folic acid, as may be seen in its tropical or non-tropical spirit in anemia of a nutritional origin, pregnancy, infancy, or childhood. So the next is preparation, dosage, and frequency. 9 to 13 years old is 300 microgram. So the contraindication, hypersensitivity, anemia, other than megaloblastic, macrocytic anemia, vitamin B12 deficiency, anemia, uncorrected pernicious anemia. So the adverse reaction is bronchospasms, erythema, malaise, pruritus, rash, and slight flushing. So the nursing action and consideration: assess for fatigue, dyspnea, weakness, dyspnea that are sign of megaloblastic anemia. Assess for HGV or HCT and the reticulocyte count. Assess for nutritional status: brandies, dried beans, nuts, fruits, fresh vegetables, and asparagus. So 9 is nursing care plan. So assessment, subjective. Nanghihina po ako at hindi po ako makapaglaro ng matagal, verbalized by the patient. So objective is fatigue, greater need for sleep and rest. Vitals taken as follow. Temperature is 36.9. 75. Respiratory rate is 18 and blood pressure is 100/70. So diagnosis: activity intolerance to related imbalance between oxygen supply, delivery, and demand. So planning, short term. After 8 hours of nursing intervention, the patient will report an increase in activity tolerance, including activities of daily living, demonstrate a decrease in physiological sign of intolerance, display laboratory value within acceptable range. So the long term, after months of nursing intervention, the patient is free from weakness or risk for complication has been prevented. So the intervention, independent, assess patient's ability to perform normal tasks of activities of daily living. Note changes in a balance gait, disturbance, muscle, and weakness. Provide or recommend assistance with activities or ambulation as necessary. Allowing patient to do as much as possible. So collaborative. Monitor laboratory studies, HB or HCT, and RBC count, arterial blood gases. So the next is rationale. Influence, choice of intervention or needed assistance. May indicate neurological changes associated with vitamin B12 deficiency affecting patient safety or risk of injury. Enhance rest to lower body oxygen requirements and reduce strain on the heart and lungs. Although help may be necessary. Help team is enhanced when patient does some things for self. Encourage patient to do as much as possible while conserving limited energy and preventing fatigue. So evaluation. Patient reveals an increase in activity tolerance demonstrating a reduction in physiological sign of intolerance and laboratory values within normal range. So may next nursing care plan. So assessment. Naging anemic lang ako nung nagkaroon na ako ng period. So diagnosis. Imbalanced nutrition, less than body requirements related to iron deficiency anemia. So planning, after 1 hour of nursing intervention, the client will be able to verbalize understanding about the causes and the effect of iron deficiency anemia before and after the period. So in the intervention, explain to the client, anemia is a normal event happening when she has a period. Iron deficiency anemia is caused by inadequate iron in the blood. So the rationale. This will give the client knowledge about the conditions he is experiencing. So the evaluation. After an 1 hour nursing intervention, the client was able to goal-met, verbalize understanding about the causes and the effect of iron deficiency anemia before and after the period. Understanding about the way of client may follow to prevent iron deficiency anemia. So, 10 is a course in the ward. Day 1. Patient X, 10 years old, female, was admitted at exactly 9:30 a.m. last June 1, 2021. Accompanied by her mother with chief complaint of abdominal pain and rectal bleeding because of premenarchal. She was admitted under the service of Dr. X and the following orders are given. Blood pressure, temperature, pulse rate, respiratory rate must be recorded every shift. For abdominal ultrasound, MRI, and complete blood. It was done at the same date. The physician ordered to take medicine, ferrous sulfate 100 mg a day. So day 2, laboratory exam were forwarded to the physician. As assessed, the doctor ordered medication, ferrous sulfate 100 mg tablet per day, folic acid 300 microgram per day, advised patient to relax and rest to reduce the pain, and the doctor advised the patient to eat foods with a high in iron. So the day 3, the patient was sent home and she was able to take a medication at home. Mrs. X manifests stable vital sign and white blood count. She has been given health teaching regarding self-care, encouraged to maintain a normal iron in our body, and follow her medication. She was advised to visit the clinic for her follow-up checkup. So 11 is a discharge planning. Call 911 for any of the following. You have a shortness of breath even when you rest. Seek care immediately if you have a dark or bloody bowel movements. You are too dizzy to stand up. You have trouble of swallowing because of the pain in your mouth and throat. Contact your healthcare provider if you have a heartburn, constipation, or diarrhea. You have nausea or are vomiting. You are dizzy and very tired. Next is you have question or concern about your condition or care. The next is the medicines. You may need any of the following. Iron or folic acid supplements will help increase your red blood cell and hemoglobin levels. Next is bowel movements. Softeners may be needed if the iron supplements cause constipation. Take your medicine as directed. Contact your healthcare provider if you think your medicine is not helping or if you have a side effect. Tell him or her if you are allergic to any medication or medicine. Keep a list of medicines, vitamins, and herbs you take. Include the amounts and when and why you take them. Bring the list or the pill bottle to follow-up visit. Carry your medicine list with you in case of emergency. So the next is eat food rich in iron and proteins. Nuts, meat, dark leafy, green vegetables, and beans are high in iron and protein. Do not drink coffee, tea, or other liquid with caffeine. Limit milk to 2 cups a day. You may need to meet with a dietitian to create the right food plan for you. So, next is drink liquid as directed. Liquid help prevent constipation. Ask how much liquid to drink each day and which liquid are best for you. And the last is follow up with your healthcare provider as directed. Write down your questions so you remember to ask them during your visit. The last is a prognosis. The patient's main symptoms had been elevated. She had a severe anemia, which is she need to take a medicine who high in iron and needs some rest. She was kept under strict observation for any potential consequences. She has demonstrated a lot of improvement and favorable outcomes while being followed. With no known issue, the patient was well and it's better shape when she has a discharge.